My name is Neva Bartholomew. I am a primary care physician. I'm the Deputy Chief Medical Officer for Partners. And I was hired about 2 years ago in preparation for go live for Tailored Plan as part of the introduction of physical health into the tailored plans that were previously just managing behavioral health. So I'm happy to be here to talk to you about Tailored Plan. I do have a daughter who is 20, almost 21, who has intellectual disability related to a genetic syndrome, who also is in a tailored plan. So I can speak to that from a mom perspective as well. Allison?
Hi, I'm Allison Crotty. I'm the Senior Director of Member Services over call center and member engagement department and member operations at Partners, LME MCO, and now Tailored Plan 2. So I am both the parent of a 31-year-old with intellectual and developmental disabilities and autism who's nonverbal. And I've definitely walked the walk and learned about services personally. And I've worked as a mental health clinician and in this system for well over 20 years. So I've worked in the MCO world first as a consumer affairs director, and I'm a forever advocate for our families and really want to get our families and members, self-advocates, all the information that they need to live a better life. Happy to talk to you again tonight.
So again, welcome ladies. Thank you again for your service to our families and as amazing moms. So we are going to go into our questions that were submitted by our families. We have dropped these in the chat. We are going to be capturing these answers for our families specifically, so they will be able to get those responses and those that have registered for tonight's event. And if we need to add any at the end, like if time allows, we will do that as well. So just getting started, a very simple and basic, but I think a question on everyone's mind. Everyone keeps saying I should apply for these waivers. My son is only 14. When is the earliest I can apply?
You want me to start, Neva? Okay.
Sure, Allison.
All right. I'm trying to pull, oh, now I can see them. Okay. I saw them on my other screen. Okay, so we do encourage
people. If you want to share screen with part of like whatever referencing back to the presentation, feel free to do that at any time as well.
Okay, yeah, I had just pulled it up so that I could do that. For this question, I can just answer that we have always been encouraged as a family to apply as soon as possible. So from birth on. And actually, if anybody has experienced having a premature baby, there is a special SSI for premature babies that you should apply for right away through Social Security Disability. But even if you don't need it at the time, you never know when you would need it. And the wait list is so very, very long. There's a lot of work being done by advocates and the state to reduce that wait list. And like maybe some states get rid of it, which would be really great. So I would say apply, get on the Registry of Unmet Needs wait list as soon as possible. Once a child is 4.5, 5, they have better cognitive or the IQ testing and adaptive functioning. Right, Neva, you might want to step in here, but that's definitely an ideal time to do it. You don't do it right at birth, certainly. And question 2 is about that as well. Neva, do you want to go into that? And
yeah, I will say Down syndrome is generally a diagnosis that qualifies you for the innovations waiver. And so
true.
For folks who don't have a clear genetic disorder or syndrome that causes you to be eligible, yes, you have to qualify based on functional assessment. But earlier the better. You can get on the innovations waiver waitlist because it is a long waitlist. You certainly want to. The waitlist differs from county to county. So there's not like one amount of time that people wait. Certainly some counties wait longer than others. And I saw this second question about suits. I don't know of anybody who sued and gotten a waiver spot, to be honest with you. We do have emergency. It may happen. I don't know.
Yeah, and I guess that's where we, even in this kind of conversation, want to clear up, as long, like, follow protocols, be proactive. There are ways that you can do it.
Yeah, and really, I don't know of any. Anyway, I do know there are emergency waiver slots every year, and certainly it's worth applying for those. There's not a lot of them, and usually they go to people who are really in emergency situations and have to have it right now. But just so you know, they do exist every year. But otherwise, unfortunately, there is a wait list, and probably the thing that makes the biggest difference to improve that would be working with your legislature, because they're the ones who decide on the funding of the wait list, unfortunately. We call it the Registry of Unmet Needs, but most people call it the wait list. Now, there's also the CAP-C. I will mention the CAP-C waiver. If your child has significant medical fragility, that's another waiver that you might qualify for. And you have to apply. You can certainly talk to your LME, but that application goes through the state and is decided on directly by the state, not by the LME MCOs. And that wait list tends to be a little shorter.
And we do a lot of transferring people from CAP-C to innovations when there's a slot available.
And I'm just sort of assuming everybody saw our previous talk, but the innovations waiver is a waiver of the usual qualifications for Medicaid that is specifically for people with intellectual disability, that provides a lot more services than basic Medicaid, including a lot of services in the community and in the home. So there's a lot more to gain from getting the innovations waiver, even on top of regular Medicaid.
Right.
Thank you for clarifying. And most of our participants are the same, but thank you for also clarifying for some that might be different. We did just another follow-up question, because you did say that having that diagnosis of Down syndrome does qualify you. But we have had in question 3 a family reach out that they qualified for Medicaid when their son was born in 2019 because of finances, and it's been a blessing. But he is now in the managed healthcare plan, and curious, did he qualify because of Down syndrome? And is that part of the shift now? The qualifying is different by just having Down syndrome, because she said that she has talked with 7 people within the Medicaid system that can't give her insights on how to qualify or make sure she can continue his qualifying if income shifts, I guess, is more where the question.
So that's more of a Medicaid eligibility is based on income until a child turns 18. So that is the difference with that. But as far as services, based on that diagnosis, and then there are, depending on the service, there are some qualifications for evaluations at the LME MCO or tailored plan. But there are many services that are available right now. So the 1915I services, and you would just need to contact the MCO, make sure you're on the Registry of Unmet Needs wait list, and then ask for a care manager to get linked to services. So it says so many states issue Medicaid automatically for this diagnosis. Yeah, so I think you still have a wait list, right? But while you're waiting, we now have these 1915I services that are very similar to what you can get on the innovations waiver. So there is just a couple of them. You've got community courts. Let me see if I can share that slide. All right. Look on the right side here. These are the current B3 services. This is the waiver that's transitioning to the I option, but they're really the same services. But community living and support is what you can get on the waiver. community transition, individual and transition support, respite is another one, and supportive employment. I think we have the grid here. This is better because it shows you by diagnosis. And so these are the IDD services, except for individual and transition support, which is more of a mental health service.
And these are things you can get while you're on the wait list for the full waiver. If you qualify financially, you still have to qualify financially, unfortunately, to get this. But it's a much higher income level than it used to be. So that's good news. And that may be what's to this point in this question. The person said they had Medicaid based on finances and they still have it. And is it because their child has Down syndrome? Probably not. Down syndrome alone would not qualify you for Medicaid unless you're 18 or over. And at that point, I'm wondering if there's a couple of things that could have happened in this situation. Medicaid there were no re-eligibility criteria placed during COVID. So nobody had their income looked at for a couple of years. So if you were enrolled in Medicaid when COVID started, you stayed in Medicaid until recently. They're just starting to look at incomes again. And so you may be hearing about people coming off the Medicaid rolls because they're looking at the income again after 2 or 3 years of not doing it. So that's a possibility. The other possibility is there's Medicaid expansion. So the income at which you qualify for Medicaid has gone up quite a bit. So it's possible that you may started making more money, but you still qualify for Medicaid under the expansion criteria.
Exactly.
So there's two things that may have impacted that, but it wasn't the Down syndrome diagnosis of your child, because unfortunately that's not automatic Medicaid in this state, like you say.
Right.
Your child could qualify for the Innovations wait list right now.
So by having Down syndrome, so thank you for clarifying that. I think that's where the miscommunication lies, is that it does automatically qualify them for the Innovations waiver wait list, the Registry of Unmet Needs, not necessarily for Medicaid and Medicaid services.
Right.
Thank you.
Right.
I think there's a lot of misconception and confusion of that within the community.
And it is different in other states. Some of them don't have a wait list, so they can go straight into these waivers, right?
Mm-hmm.
Correct. Yeah.
Yeah. And these services that I'm sharing, they're Medicaid services. And we do have state funded services that somebody with private insurance or no insurance could potentially receive, but there's limited funding for those.
Okay. And like they also mentioned, I also want to reiterate, and my former colleague and great advocate, Donna Beckman, contact your legislators. It's an important year to get change and to get policy and to get that wait list down and eliminated, and just reach out. And we will also be attaching those phone numbers and those contacts to this follow-up as well, as we can all push forward to help advocate. So again, thank you for reminding us of that.
Well, and going back to that same question, I noticed she mentions that, I don't know if she's talking about her son or her family being in managed Medicare, but her son or daughter who has Down syndrome should be in a tailored plan. Down syndrome, if you're in Medicaid, Down syndrome is a qualification for the tailored plan. So that's the type of managed care you should be getting at this point. Just wanted to clarify that too.
Thank you. Because that kind of can go right into the next question of the new mom. And we have a new mom that I am working with, and she just received her Taylor Plan Care Card. And she said, what does this mean? What do I do? What do I qualify? What is my next step?
All right. So that card is the insurance card for her son. And so she can use that with any in-network tailored plan, whatever tailored plan she has, physical health, and then contact that tailored plan to request services, if applicable. But at that point, she's probably in doing early intervention, and they'll be linked in that way, and coordination of care. But just learning about the plan and the different services will help with those transitions as you go. So a lot of the plans offer monthly seminars or recorded trainings and just talking with that registry team of people at the tailored plan, and they can help guide. But the Children's Developmental Services Agency is typically doing most of that work from birth to 3, right? I think it is.
Well, we actually do tailored care management for that age group as well now. So her son can qualify for a tailored care manager who would work with the child at the CDSA, and work with her about any sort of other social needs they might need. There is non-emergency medical transportation for appointments. That's an option. Yeah, I think often probably getting the tailored care manager would be a good step if she doesn't already have an association with one. She may not feel like she needs it right now, but as their child gets older, there'll be a good connection to help her. The CDSA and all the early intervention is probably the primary service for right now, right? But
yep, and that's where we connect. But just wanted to clarify for families that are already getting those services, as they are brand new and fresh. You guys are the experts for us to guide us and guide them.
And when they get that ID card, they are supposed to get a full packet with a member handbook.
Okay.
There should also be a letter either with that or separately asking if they want to opt into tailored care management. So that should have been offered to them. And if not, they can call and request it, as Neva said. Yeah.
Yep. And I'll make sure to follow up as the family support specialist with our new moms, because I think some have been overwhelmed in the process. And like, I think I signed something. I think I'm getting something. I'm not. And so I'm not. I think some moms are just still unsure. Some of our brand new moms that are like,
as any mom would be with a 4-month-old.
Right. So thank you for clarifying those clear-cut action.
And the tailored care management service and tailored plan can be very confusing. So when you hear both those things, and they both have the word tailored in them, tailored plan is the health insurance. Tailored care management is a service that we provide as part of that health insurance. So people have thought, well, I thought I opted out of tailored plan. No, you probably opted out of tailored care management, not tailored plan. And I encourage people to opt back in, even if you don't think you need it, even if you don't really want it right now, at least establish that relationship.
Absolutely. All right. Going into transitioning to young adults. So my daughter is 19. Can I apply to be her caregiver, or what steps can I take to be a guardian and caregiver, or how does that work on plan or shifts there?
So they want to be a caregiver as far as provide services? Is that the question? Like a relative as direct support? Yeah. So a relative is,
because kind of the next follow-up that I think could from the same family as, if the needs aren't being met, what can I do to get that additional support or provide that support?
Okay, so that's question 6 is related to 5. This is what you're saying.
No, okay. Can you see the questions in the chat, Allison? It's a lot easier to read them.
Yes. Yeah, I have it right up. It says my daughter's 19. Can I apply to be her caregiver?
I just didn't know if you could see them. I just realized they were there.
I see that as if you're already receiving services, so you would talk to the provider, because that's where it starts to become a relative as a direct support employee. So you would be an employee of that provider agency, and you would provide either as backup or relief, or sometimes primary of relative could be that caregiver, and be reimbursed through Medicaid through that provider. So if the relative or the guardian is an employer as part of the individual family self-direction, family directed option, they cannot be a relative as direct support employee. And
you froze on my end. Out? Yep. Give me just a minute. Yep.
Okay. But anyway, the provider agency will guide you in the process.
And what if that?
I believe there's some cap on the number of hours you can do a week. but I don't remember
Okay.
what it is. That's the other thing I would
There
add.
are limits, there are service limits, and that's all in there are clinical coverage policies that lay that out. Yeah.
And then what if, just to take it from a different lens of having that 19-year-old, so that was saying if the provider was already established, what if I have a 19-year-old and I don't have anything established? What would my next step be to take to establish that provider contact?
If you don't have any services in place for the 19-year-old at all?
Yes, or we have
Yes.
families
So
relocate.
So hopefully, you would engage the manager to help you get engaged in services. You can go ahead and look at the available provider agencies in your area on your own and call them and check them out. See, talk to people who have used those providers. Choosing a provider who's going to have available staffing, which is pretty hard to do these days. But, I've even had to have 2 provider agencies so that I could get some hours covered for my child. But the tailored care manager can guide you in that whole process.
Yeah, the care manager is really the key, because they need to sort of assess the situation, figure out what the needs are, how many hours they might need, what organizations might work best, and really help you reach out and get those in place. But yeah, direct service providers right now are hard to come by, and we all know that.
Yeah. And that's what's
Right.
been our issue in that field, as
Yeah.
well as connecting with CDSA. We've had some issues with the providers in that field
Yeah.
as well, which we understand.
And I think it's fair to mention that part of the relative is direct support employee. Some just underpinnings or caveats that, people feel it is best that you have somebody else other than a natural support, because you have natural supports and paid supports. And but there are conditions when you can't get other staff, which is really all of us are facing now across the country and probably the world, that just very few direct support and professionals who are available. So oftentimes the parents are doing it. They're the ones doing it. But there are certain conditions.
All righty, thank you. So question 6 was, what can I do if my needs aren't being met? And again, I think you've addressed this with contacting that care manager to request additional support or services. And then if it comes down to needing to provide care for my child or losing a job, what could I do? How can I advocate? Who can I call? Any additional thoughts to support other than what we've already addressed?
Yeah.
Well,
So
Allison, go ahead.
yeah, go ahead. No,
Well, I
you
was
go
going to say,
ahead.
you made a really good point before, which we had to do the same thing. For years and years, I thought, well, we had picked a provider and that's who we had to use. Then I realized you can have more than one provider. And that actually helped a lot, because then it was like a new pool of people to choose from, and made a big difference. So, looking beyond that one provider that you have a relationship with helped us.
Yeah, and looking at a range of services, depending on, what best fits your child, what can they handle? Do they really want to be in a day program? Do they want are they better with one-on-one? And it depends on their age. So there's an in lieu of service that is supposed to keep people out of residential or higher levels of care, or ICF, an intermediate care facility, institutional level, and that is community living and supports. And that service is for 22 and older, but the state and advocates are trying to get that age reduced, because not everybody with IDD wants to go to school until they're 22. So I know my child didn't, and she was tired of it. So that provides a meaningful day whatever that means for that person. So it's person-centered. How do they want to spend their day, and what supports can we put in place? Let's look at the menu of services, whether it's supported employment, day, a mixture of day program, some respite thrown in there. What else do they need? And it could be they have physical health needs and they need nursing respite. So it just depends. But sometimes the program or the group level can fill in some of those gaps to get where you need less staff, if that makes sense.
Absolutely. And thank you for sharing those personal experiences of what as well of thinking outside of that box of outside of that one provider, how can I receive what's best? And
Well,
that person centered, it's unique to each family, and to really reach out and find out what's best and what's available for your family.
Well, and I'll add one last option, which is worth mentioning, but I will give you a caveat that it's not easy. But there is an option of doing employer of record. Instead of using a provider, you become basically your own provider. We just started doing that with my daughter, and it is a little bit like having another part-time job, because basically you have to make sure they get all the training, you have to do all the interviewing, you have to handle all the payroll, but it allows you to pay them better than the providers can, because you get the rate directly to you rather than going through a provider. And that has allowed us to be able to recruit easier and keep people longer. So it's got its pros and cons, and you have to have the time and energy to put into it, but it has allowed us to find more people. So that's another option. You have to have a lot of training to do it. We didn't do it until recently because we knew we were overwhelmed, but it has been an advantage.
Yeah, some families have really, that's been an answer to prayers for them. Yeah,
And I
and
would
you do
just
have that
follow up.
financial agent. Oh, go ahead.
Is it with that, because that had come up with another question in person with someone with that employee record, that is still a possibility even within these new tailored plans? Yes. Okay.
Yes.
And thank you again for hitting it from all angles, all lenses, all possibilities. That's exactly what we wanted to be able to do tonight. So again, thank you. Thank you. So I think you just addressed kind of question 7 within question 6 of where do I start for those hours of respite. So kind of those clear-cut steps to meet what's best for each person. So then the next set of 4 questions are kind of just, I'm going to give each of y'all time and then kind of just give us your best response. We're going to kind of go through age brackets as the North Carolina Down Syndrome Alliance do support across the lifespan. We do have prenatal all the way into adults. And so just wanting to really be able to meet the needs of all those new families, school age families, young adult families, transitioning and aging families. And so we're just going to start. What are the top 3 things as we're making these transitions for a new parent in the prenatal to like age 5 that you would say they need to know, they need to do, they should have done? And
That's
no
a tough
pressure.
one.
I know. It's going to be the same question. We're just going to go through age brackets. But when you think through, because you've gone through so much richness of everything, but if we could get those like action steps 1, 2, 3 for those new families, what would be your 1, 2, 3?
Well, for me, I mean, luckily people are doing it because they're part of your association, but whether it's through an association or through a friendship in a waiting room at a therapy practice, find somebody that's going through something similar, because that was the best thing that moved me past that grief period where I that the huge part, all the stages that you just kept going back and through. And, of course, we know they never end. But so, I mean, but the hardest part of it. So finding somebody where you can talk about the stuff and not feel like, somebody's pitying you or they're shocked because, you're frustrated with your child and they think that that's terrible, right? Or something like that. So find somebody you can be yourself and also learn from and be around other people, not just with the same age kids, because you learn from the ones that have children that are older and going through other stages, so that's a big thing. And for me, it was just being involved as much as I could with whoever was providing care for my child, whatever agency, learning resources that were available to me, of course. So the same things you all are doing.
So I agree with all the things Allison said, and she took the social, maybe the licensed clinician social work perspective. So I'll take the medical perspective. Number one, I would get on the waiver wait list as soon as possible, right? And that means contacting your LME MCO, whether you have Medicaid or not. A lot of people are like, well, I'm not going to qualify for Medicaid. I know I'm not, but it doesn't matter. Contact your LME MCO, get on that wait list, right? That's number one. Number two, I would tell you to be picky about your doctors if you can. Find a pediatrician you like, who's nice to you and treats you well and treats your child well. If you haven't experienced it yet, I'm sure you will, that people with disabilities sometimes get treated worse. They don't get the same standard of care. They don't get the time. And it takes a while sometimes to find the doctor who's comfortable. Sometimes that comes from discomfort. But I think if you can have a good relationship with a doctor, pediatrician, primary care doc for your child, you'll just feel better when your child is sick. You know somebody you can talk to, and they know you, and you know them. Again, I would learn, and I'm sure you're doing this through your alliance. Learn about sort of the range of differences that someone with Down syndrome has, so that you can advocate for whatever medical care you think they may need that's different from everybody else. Because you are the expert on your child, and you have to advocate strongly if you think something is wrong or something is different, because a lot of times medical staff will say, well, that may just be their Down syndrome, and not necessarily look harder than that. So that kind of is a lifelong recommendation, but definitely as a baby and a toddler, don't just blow something off as, well, he's just got Down syndrome, so that's the way he is. If he's suddenly not eating, drinking, not breathing well, not looking right, you're the mom. You stand up for yourself, and go in there and ask for what you need, because unfortunately it happens that there's a bias and a stigma. So that's the medical side of that.
Yeah.
I
Agree.
love both sides again, taking it all, agree with all of it. Absolutely.
Yeah.
So again, top three things as you think about transitioning. I have now gotten through, like we're talking, those grief cycles. I've created that community. I'm on the wait list. I've transitioned through CDSA into a school age. Is there anything that transitions different for me? What should I be noticing? Can I check in on my status on the wait list? What would be the top three things as I'm transitioning to that school age, whether it be as we think primary, K-5, or that secondary, middle, and high school levels? Is there anything that changes in what I need or my request or that support of who I reach to?
Yeah, I think it's important to really work with the school to be in the least restrictive environment, and to widen those social experiences, widen the circle of others who can be there so that you can get a break, right? So you want to make sure that your child can relate to a lot of different people, and is not too dependent on you, which can be hard. I think the adolescent expect that your child is going to follow also typical developmental periods. They are going to be an adolescent. Okay, they're going to react. They're going to be, people expect our children with different needs to be completely different, and they're people. So first look at it from the normal lens. That's what we should be doing, right? And I hate to even use the word normal, but just expect that, hormones are going to affect your adolescent, period. And they're going to want to pull away from you, and they're going to get mad when you smother them and do things for them, and put them in positions where you're not giving them choice and autonomy, right? So, so think of what is normal. And, back to what Neva was saying, I wish my daughter's doctors would have looked at her from that lens. Normal developmentally, normal risk for, and even worse risks for certain conditions, right? And don't just assume because she has autism and she has chronic constipation that that's okay. Right? Just, sorry to get real specific, but that's and so understand what is unique about your child, how to relate. The more comfortable you are feeling in public with your child, to people staring and responding to people who are staring, even a 3-year-old that says, why is she so messy when you're at the pancake place, and your child's bigger than should be eating with their hands, or whatever it is. What do you say to them? And how do you say it nicely and make sure you have a good tone? So practice those things. I mean, because if you're comfortable, your child will be comfortable and people around you will be comfortable. And I'll think of some more. Neva, go, your turn.
Yeah, so that's a big range from 6 to 21, but
Yeah.
There's a couple of things I would say. I mean, sort of like with medical care, I would make sure that you advocate for what you need from the school district. I think I'll just tell you personally, I was just so happy that someone wanted to interact and try to teach my child and was so welcoming, as special eds teachers are, which is wonderful. They're kind of part of our special people that connect with our children, that I always felt bad ever pointing out anything I wanted them to do different. Like, I didn't want them to ever get mad at me. I was just so grateful for them. I never wanted to be that kind of pushy parent. And I have regrets now that I probably let a lot of things go that I should have said something about or pushed harder about or tried to get more speech therapy or tried to get them to actually do more, instead of just being, oh, thank goodness she's okay and safe here and y'all love her, So I think it's okay to go into IEP meetings with a plan, with an advocate, with we need to see what the goals are, we need to see what the data is, and not just go in and say, I'm so grateful for all of you and thank you for loving my child, because that was my perspective for a while. And I let a lot of things go, and then we were kind of behind where we should have been, where I should have been on it more. That's just me personally. So it's okay. Don't think you're a mean person. You're advocating for your child to go in and say, this is what I need. These are the goals I have. I want to see you working on this from now on. Why didn't you work on this? I mean, you can do it in a nice way. And if you don't want to do it, there are advocates who will go with you to IEP meetings. And learn what your rights are, because that took me a long time too. I did not know that I had a right to ask for things like a behavioral assessment for my kid in the schools. That took me till middle school. And that made a big difference, because once we had that, then we had more of a plan of how to manage behaviors. But no one told me that was something to write. I'm sure it was in that handbook they give you, but does anybody read that handbook? I don't know.
Right. What about guardianship, Neva? Don't you wish they would have told us to have your plan mapped out for guardianship and the steps well before they're 18?
Yes. So, and it's really not as hard as it sounds, but you just have to plan for it. You have to know what it is. You have to understand what it means. And it is worth doing from a medical perspective, because I worked in the psychiatric hospital for 11 years. And I took care of a lot of patients who didn't have a legal guardian, but weren't capable of making their own decisions. And it was very, very confusing and hard. And, it goes to like ethics committees and then legal stuff, and doctors won't know what to do, and they'll want to do what that person's saying, but they know they can't really. And if you can establish guardianship, then you know that you're going to be the decider if something happens, right? I'm trying to think of other things for that age. Well, like Allison said, puberty happens to everybody regardless, right? If you have a daughter, there are ways to control her periods. And I think that's worth talking about and looking into and discussing with your doctor, because that can be really hard. Yeah.
Absolutely. We've even talked about as the alliance of that being a specific touch point of remembering two big takeaways of typical developing behaviors and how to address those, how to address them as a parent of an individual, and how to help them and their community also be able to also address those needs and concerns,
That's
but
right.
treat those typical developing
Yep.
appropriate behaviors. And then we had talked about kind of like puberty packs, of really having that conversation of how could it look different, having those supports in place to help walk through that process, but that it's going to happen, and that's what all teens go through, and all the emotions and hormones that come through that age group.
That's right.
So thank you again for reiterating that and answering those for that age group. So then moving into transitioning now into young adulthood, I've moved past kind of what would be provided up to like 21. So now I'm 22 to 35. Is there anything that now transitions as you also say plan for that guardianship? That kind of 18
Well,
is when plan before, but then at 18, what kind of
yes.
transitions as what my support services, what I need to do? So
You want
kind
to
of,
go first, Allison? I like following you because then you get all the good stuff.
Oh my goodness, I don't know. That age, I think, to me, it's very important to work with a care manager and others to think about what are your goals for your child for the next 5 years, right? And then after, and how can you help them be as independent as possible? So independence is the main goal. That adolescence will just stick around for a while because it just will, and they're going to want to be with other people, and that will be good for them. So how can you create a day that they're not just in a group home of one with you? Because you know that's, if disability is natural, right? Growing up is natural. How can you create that best succession of where your child goes? They would normally go to college. Well, look at college programs. They're out there. So look at ways that, don't be limited by what you thought of would never happen because of the diagnosis. Your child will surprise you. So find out what is available, and then come up with a plan with them as much as possible, of course, So I think that age is a really tough one for parents. I know for me, emotionally, it was really, really hard. So I had to make some big decisions about, not handling my child at home, looking at options in the community, what would be best for her, limitations of having staff and keeping a job, like the other question brought up. These are real issues and they pull at your heartstrings. So talk to a counselor, talk to somebody who can reflect some things back for you and normalize some thoughts. Make sure you're not getting mired in irrational guilt about things that maybe you don't need to feel guilty about. And while you're doing that, working through the emotions, go visit places in the community. Go look at uh, the supported residential programs. There's what is the supported living, where you can live with a roommate. That's a service, but you have to be in innovations for that. But there are other things there in the community, even if you're not on the waiver, that families have gotten together to develop independent housing for people with intellectual and developmental disabilities. And that, not even touching on the employment, but that's a natural success and succession of what you would do, right? Develop. So at what what job can my child be successful in? My friend's child works in a dentist office a couple days a week, helping them with the bags or doing this or that. He loves going to you know what I mean? At what level, and push it, because this will make your child feel good. It will bring a meaningful day.
Yeah, and actually it goes back to the previous age group too, because really these needs to be in your plan at school during school years. what is the transition going to be? What would be a good future? How do we work towards that future? How do we work towards independence? Even starting in, third grade, you need to start thinking about being as independent as possible. And then as you get to high school, then there really is a whole lot of focus on transition to adulthood and moving towards that vocational path there are several really good college programs now. And there's a lot of variability in all the options out there for whatever your child can do. Same with living. And I would start early into thinking about what kind of environment would they like to live in. I can tell you with a 20-year-old that, like Allison says, it's very hard. You want to make sure they're safe and okay all the time, but you're not going to be here forever. So where's the happy middle, and how do you? That's kind of where I am right now. So I can tell you it's a hard place to be. But again, going back to what Allison said, having other people that are in the same boat helps a lot, because otherwise it can be very isolating. If you don't have anybody who knows what you're going through. And I think going back to even the beginning, I should have said this early on, you got to take care of yourself. There's, you can give all to everybody else and have nothing left for you. And eventually that you burn out.
Right.
Easier said than done, I know, but it's like putting your oxygen on yourself first, right?
Yes.
Frequent flyer miles, yes. Put it on self first. Then, so then just keeping kind of into that same conversation. So into that adulthood, anything else in the 35 plus or anything specific that I'd want to make sure, or we even have new families moving to North Carolina. So what would I do as with a young adult, or also we have siblings transitioning into that guardianship you have spoken of, and what would we guide them in their first steps to access support services, because even they wouldn't get waivers just because they had it coming new to the state.
That's
what
right.
would be
unfortunately not
their first steps, right? So it doesn't cross over from state. If they did get it ahead of time in one of the lower counties that you said the wait list is shorter, that does not impact county to county transfer, correct? Like across within North Carolina, it would stay. It doesn't. Yeah. But because we've had
county to county is fine.
Yes.
Right.
Yeah. But when they're moving in and in that adulthood, what would be your top 3 things to do, next steps, first steps?
The one thing we forgot to mention is that most folks will qualify for Medicaid at 18 if they qualify for disability. So getting evaluated for disability before 18 will give you SSI and Medicaid at 18. So that's important. Go into your DSS office.
Can you restate that? You did. You froze
Allison
on my
can
end.
probably state it better than me. Allison, you want to state it better than me? Right. You heard me, right?
You said you're at 18, they become a household of one as far as Medicaid's concerned. And as long as they've already been determined to have a disability by Social Security Administration, then they will, the income won't matter, and they will then get supplemental security income.
Right.
And they will get Medicaid along with that.
Right.
Based on their disability and the income being. So if there's any money in that child's name, and if they have gone through, if you're going through a divorce and they factor alimony into it or child support, that can impact the SSI, and the Medicaid. So I would say talking with people who have the expertise with the legalities about disability and Medicaid, having a plan for in the event that you don't survive, right? Then through old age for your child, right? Which is, you just have. So, and you have to have a plan for when you retire or your spouse retires, and that will affect your child's waiver potentially. There are these spend downs. So you want to always keep in mind that there are things that can affect Medicaid, and talk to the tailored care manager about it. They are experts on this. They deal with it all the time. Vocational rehabilitation is another good agency that you can go through with somebody with Down syndrome, and they can help with work, supported employment, those types of things. And they also are disability. They do disability benefits counseling. I couldn't think of the word, but they can help with the benefits counseling. So if they receive benefits from work and then their Medicaid, and they can help guide you with that as well.
All right, so I think that was our last of our set of questions. I think I did have one other question pop in. I do again want to thank you for just giving all perspectives, personal perspective, professional perspective, all lenses, as we go through these real questions with real answers to support. I did want to leave it with, as you did speak to contacting your legislators, we talk about advocacy. What would be 3 things that as a parent I could write or I could say right now to try and help push, to try and help advocate for more or different from your lens and your professional backgrounds?
Is the question,
Right.
what could you advocate for right now?
Yes.
Yeah. Well, I would say the direct support professional increase in pay, and to make that a valid with training. There is a huge movement in North Carolina, work group that is focusing on that. You can join that. So make sure you're getting the Division of Health and Human Services, all their subscribe to get all their communications. And there's a community engagement team. Join or at least attend the Consumer and Family Advisory Committee at your tailored plan, and you will learn a lot. And they do a lot of advocacy. There's a state Consumer and Family Advisory Committee. They have meetings all day, once a month on Wednesdays. You can attend that and you can speak out and their public forum. So these are all public meetings that you can attend and speak at. There's Disability Rights North Carolina. They have a lot of good information on their website about advocating for yourselves and for and help people understand their rights. What am I missing, Neva? Let's see.
I would say if you can, get to know your state senator and legislator. I think they are very receptive to hearing people's stories. They're very powerful stories. So if you can get to know them, let them know about your family and sort of the difficulties with getting the care and the funding you need. I think that can't hurt. The more people that do that, the better.
Yeah, and some of the issues that are also being addressed on the state plan are putting language out that people understand, because it's so complicated, the system. There's a great, I need to send this to you, Betsy, and you can send it to everybody, but this really great article, remember the one this is a housing network, PACID, PACID. And she wrote this wonderful article about the need for housing and how people with IDD are being ignored, and their housing needs are being ignored. And anyway, there are so many great committees and parent organizations across the state that have some really great platforms that you all will be familiar with, and you'll want to jump on the bandwagon. What is another one? The DSP, the wait list. Oh, one that I'm on a direct support professional advocacy committee And if anybody's interested, let me know and I can get you on that meeting. It's every Thursday at noon. It's a Zoom. But something that's been identified is that spend down when somebody retires and then it affects your child's innovations waiver. You have to spend down this money before their, waiver services. Anyway, not to scare you too much, but we need to get rid of that. It's one of those crazy loopholes with Social Security, and we need to get together and try to advocate for them to change that. CMS can change it. Laws change. So if, don't be
believe
afraid
there's
to wish.
similarly been, and it may have actually passed, some efforts to increase the limit that people can make when they're when they're receiving disability income, because
Right.
that has been, we've got folks that are really enjoying work and we
Yeah.
want to pay them an appropriate wage, but then the minute they make money, they lose their disability income, and that's very unfair. So I think there's some movement towards that as well.
Right. Yeah.
Just
And
reminding me of that.
and it's really the government, local and federal and whatever, to raise the limits that haven't been raised in so long. They finally just raised the limits for the innovations waiver, It's taken a long time. But so did we address the question and everything from the chat?
Yes, and then
Having
another
twins
question
and moving.
came in, but
That's a
yeah.
tough
And
situation.
so that's a big shift. Do you have anything else to add other than thank you for already letting her know, contact that case manager and who that would be? And so I'll just take a few minutes if y'all are okay
Appreciate
and open it to the families that are still with us tonight. If there were any other questions. Let's see. I keep going in and out. Let's see.
Yeah, somebody asked if they can how to do a Cap C, and your LME or Taylor plan can help you, but you can do it directly. But if you have Medicaid and kids with Down syndrome, you should be in Taylor plan and have a Taylor care manager also. Although if you get Cap C, you lose your TCM because they have their own care management, but you still have the your most of your services will still be through your LME. So good to get to know them.
Right.
Well, what
And
is an
Cap C is
LME?
only
Like
for
I'm
children,
not
so
understanding.
eventually you
Yeah.
will
I'm not
transfer.
understanding all the acronyms. Like what is an
Oh, so
LME
sorry.
and where do I find an LME? I don't know what an LME is. So
Yeah.
if you could, I don't understand all your
Sorry, we did a whole talk on this
No,
before.
I watched that talk. I watched it. I had trouble following it too. So I did watch that.
Sorry.
And no, and I
That's
can
all
address that too, just from our perspective. We are also going to send out the follow-up, the map. So your LMECO is based on your region in North Carolina. So Alliance here in the Raleigh, our area is our support. And then we also have Voya partners and Trillium across our state. And our partners are with us tonight and supporting us. And so that map is going to be in the follow-up email, Kathy, that will give you that direct contact to what they are speaking about. And that will be a direct email and a phone call that you can contact directly in to get started with a care management and ask the questions needed to support your family. And so that is going to be a follow-up that comes out to you all as families, so you don't have to search and think what it is, because I do know it is a big topic. There are acronyms, and I know we had a whole amazing presentation recording. I know even part of our staff, we've all been rewatching it, and it's a lot to take in, and we want to make sure.
And we use these acronyms without thinking twice about it, so forgive us. We can't help
Yeah,
it.
so sorry.
And so I don't also, Kathy, I don't want you to feel that you don't know them, because as a mom of a 7-year-old and also an advocate for NCDSA, I'm still learning them all and not losing a letter or what letter goes where, or
But
So
you know
thank
what? Even if you spell them out, if you say the words, it doesn't clear it up. Okay. So a local management entity organization, basically they're what the area agency or company that can help you get services. They're the one-stop shop to call. And even if you don't have if you have a Medicaid temporary card, you don't have insurance, you can still call them. And they have a 24/7 behavioral health crisis line. And that includes for people with IDD or anybody who lives in those counties. that are affiliated with that tailored plan or managed care organization. What county? Hers was Trillium. So you can call Trillium 24/7, 365, and try to get linked to some services. Well, the crisis number is available 24/7, but yeah.
So while you were waiting for Cap C, you might qualify for some of those 1959 services that Allison mentioned, and you would qualify for tailored care management while you're in the process of getting Cap C. It may be quick, it may not. So just to know that's the LME NCOs are also the tailored plans. They run the tailored plans. So it's all the same place, but that's your one-stop shop.
Right.
Thank you for your time.
And feel free to reach out to me, and I'm happy to walk you through some of that alphabet soup and to kind of give you the lay of the land. I know I even attempted to move to Maryland when my mother was ill, and move my daughter up there, and it was a futile. I hightailed it back to North Carolina. So you all are brave souls, and feel free to reach out to me. I'm going to give you my information if you want to talk further.
Yes, I was gonna say I will include both of y'all's contact as well.
Okay.
Okay. If you want to drop it in the chat, please do that. And I just want to again thank you for being with us tonight. Again, sharing your expertise from all avenues, professional and personal. And I did want to just mention all the organizations that collaborate with us to make it possible to bring you with us tonight. So Coastal Buds and the Down Syndrome Alliance of Western North Carolina, the Down Syndrome Alliance of Winston-Salem, of the Greater Charlotte area, Greensboro and Carteret counties. So just on behalf of everyone across our state, while I know you serve specific families, we are thankful that you are with us to support all families. And as I mentioned, families, we will be following up with these responses to all of these questions, as well as these connections directly to support you in your next steps wherever you are in that process. As well, always reach back to us at the NCDSA for follow-up or specific questions after tonight. But just thank you again, ladies, for both June and July, these amazing presentations and this Q&A, and rolling with it and being flexible even with our technology and not having materials ahead of time. But yes, thank you all for being with us tonight, and I hope you have a great Wednesday evening.
Thank you all. Really enjoyed it.
Thank you so much. Good evening. Good night.
You too.